Hi, my name is Alma.
Hi, my name is Sam.
Hi, my name is Nympha.
Okay, today we are going to talk about pediatric physical therapy. Pediatric physical therapy. Pediatric physical therapists not only work with children, but their families as well. The goal is to assist children in achieving as much independent functionality as possible. Pediatric physical therapies can practice in hospitals, home care, outpatient clinics, schools, daycares, and early intervention programs. The age and population for pediatric patients. According to Choose PT website, pediatric PT is available for patients anywhere from birth to 21 years old. The CDC lists diseases and conditions for patients 0 to 19 years of age. In 2018, according to childstats.gov, there were 73.4 million children aged 0 to 17 years old. Pediatric injuries. Motor vehicle accidents are the most common cause of death by injury in children aged 5 to 19. Suffocation. Infants are more likely to suffocate while sleeping, whereas toddlers are more likely to suffocate from choking. Drowning. Drowning is the most common cause of death in children aged 1 to 4. Poisoning. Every day, 300 children go to the ER from poisoning. Falls. Falls are the most common non-fatal causes of injury in children 0 to 19. Burns. Burns fall in the same statistics as poisoning, the difference being younger tend to have burns from hot liquid and older kids from fire. Disease, simply put, is a condition that impairs normal function. Children aged 0 to 19 are seen to have diseases and conditions like ADHD, ASD, developmental disabilities, cancer, diabetes, cerebral palsy, Tourette syndrome, muscular dystrophy, obesity, along with many more. The difference I found between what is considered a disease and what is considered a disorder isn't all that clear. I like the way it was put on the Health Writer Hub site. A disease comes from a pathophysiological response, and a disorder is a disruption of this disease to our body's function. Cerebral palsy. Cerebral palsy is a group of disorders that affect a person's ability to move and maintain posture. CP is the most common motor disability in pediatric patients. Although CP cannot be cured in a physical therapy setting, we can help improve a child's capabilities. Scoliosis. Scoliosis is a sideways curvature in the spine, usually S or C-shaped. Pediatric scoliosis is categorized according to the patient's age, the location in the spine, and cause. Most cases are idiopathic, meaning doctors can't identify the cause. Symptoms can include one shoulder being higher than the other, the head may be off center of the body, and the body may shift more to one side than the other. There are possible other uneven attributes. Here are some images showing the different curvatures in the spine, and also images showing what someone with cerebral palsy may look like. Spina bifida. This is a condition that affects the spine. It's a type of neural tube defect that can happen along the spine if the neural tube does not completely close. Spina bifida can cause intellectual, physical disabilities, and possible damage to nerves and spinal cord. 1,645 babies are born with spina bifida yearly. Spina bifida is more common with Hispanics. There are 3 types: myelomeningocele, which is the most serious, meningeal, and spina bifida occulta, which usually has no disabilities. Here are some images showing the different kinds. Muscular dystrophy. This is a group of muscle diseases caused by a mutation in our genes. There are many different types: Duchenne-Becker, myotonic, limb-girdle, fascioscapulohumeral, congenital, distal, oculopharyngeal, and Emery-Dreifuss. DMD/BMD, which is simply referred as DBMD, is the most common and typically affects males aged 5 to 24. There are about 14 in every 100,000. DMD symptoms usually begin before age 5. BMD symptoms usually appear later, even into adulthood. Weakness typically appears first in the upper arms and legs. Other parts may be affected as well, like lungs, stomach, heart, and spine. Here are some images showing where muscular dystrophy symptoms occur and what a patient may look like. Autism spectrum disorder, a developmental disability that may cause social communication and behavior difficulties. The severity of ASD differs in everyone. Some cases are more severe than others. About 1 in 59 children have been identified with autism spectrum disorder. ASD occurs in all racial and ethnic groups. It is, however, about 4 times more common among boys than girls. Sensory integration disorder. The brain has trouble responding or receiving information that comes through our 5 senses. It's most commonly seen in patients with Down syndrome. This is a condition where a person has an extra chromosome, also called trisomy 21. Down syndrome is the most common chromosomal condition diagnosed in the United States. It occurs in about 1 out of every 700 babies. There are 3 types: trisomy 21, translocation, and mosaic Down syndrome. About 95% have trisomy 21.
All right, now we're going to go on to current trends for pediatric therapy, pediatric physical therapy. So the first one is aquatic therapy. The benefits of that are functional mobility, gross motor skills, promotes posture and reduces weight on joints, and strengthens extremities. There are 2 types. There's recreational and therapeutic programs. The recreational one is just kind of a fun way to get children moving and active. The thing with that one is that the instructors lack the ability to properly train children who have disabilities. And so the therapeutic programs, they were specifically designed by PTs and OTs to not only help with the physical aspect of aquatic therapy, but also the neurological aspect. And research has shown that aquatic therapy helps with the functional mobility of a child, and the child has more opportunity to interact with other children. Early intervention is not enough, just alone. So pediatric physical therapists it's highly recommended that they give the child the opportunity to go out and experience aquatic therapy. Our next current trend is hippotherapy. By definition, hippotherapy is equine movements to develop and enhance neurological and physical functioning by channeling the movement of the horse. There are physical benefits. It improves the motor skills, core strength, postural symmetry. It reduces the abdominal muscle tone, and it helps with respiratory control. They also have some cognitive and psychological benefits to them too, but I'll talk about those a little bit later. Research shows that it does help by decreasing the plantar flexion, knee flexion, and range of motion in the hip. When it's combined with normal physical therapy, it can help the child have a greater self-independence, and the child can be more self-reliant. Our next current trend is a TheraSuit. So I know TheraSuits I haven't heard about a TheraSuit until I did this presentation. So a TheraSuit, it includes a whole outfit with it. It has like a vest, some knee attachments, arm attachments, even some head attachments as well. And they range from sizes extra small to extra large. And its main job is to adjust the posture of a child and get the joints as close as normal as possible. The benefits include retraining central nervous system. It promotes developments in fine and motor skills, and corrects gait pattern. There hasn't been a lot of research done on TheraSuits, but at this point they don't believe it is worth the amount of money because it is a quite expensive program. The TheraSuit itself is quite expensive, so at this moment they feel like there's not enough research done to necessarily recommend it. To continue with the TheraSuit, a little bit more about it. Along with the TheraSuit itself, there's also a strengthening program, and it's a very intense program. The session can go on for several hours, several days a week, and it lasts to about 2 to 3 weeks. They include a various amount of exercises, and these range from stretching to gait training to coordination. The types of exercises and exercise systems that they have what's called a pulley system, and that's to help with walking on knees, gait training, stretching. They also do just stretching and coordination. they have a suspension system, which is more commonly called spider, and that's for weight bearing, sensory integration, and coordination. Of course, they work on gait training and some functional. And I'll go ahead and show you on this next picture a couple of these. So this one is the pulley system. You can see her walking on her knees. This next one right here is the spider system. Right here is the parallel bars to help her with gait. And this last one, he's using that spider suspension system to walk on. This is a little treadmill, so correct gait pattern. Our next current trend is kinesiotaping. Kinesiotaping, it helps with the pediatric patients by inflammation relief. How it could also help is that in orthopedics, when trying to help a small child and trying to do exercises, it's not always promised that they're going to participate fully. So this kinesiotaping can help with them just by sitting down. And it helps with neuromuscular disorders such as cerebral palsy, muscle dystrophy, and even Down syndrome. It can be worn for several days and is waterproof, so they can wear it in the bathtub as well. And research has shown that kinesiotaping can assist in physical therapy in making a smoother and easier recovery. It's not proven to enhance any muscular function, but it's still recommended that physical therapists familiarize themselves with it. Our next one is the sensory integration disorder treatments. As was mentioned before, the sensory integration disorder, it's having trouble receiving and sending messages from the brain. There's two types. There's hyperactive and hypoactive. So hyperactive is just difficulty blocking out sounds, they're prone to motion sickness, and they may need assistance when walking. Hypoactive is difficulty listening, they don't get dizzy, and they're just very, they enjoy a lot of activities like climbing, swinging. So how we treat it is the vestibular sensory, which are motions as such as swinging, spinning, and jumping, and proprioceptive sensory, which is hugging, climbing, coloring inside the lines, buttoning shirts, and of course hyperactive would go with the proprioceptive and hypoactive with vestibular. Research has shown that this mainly happens in autistic children, and research has shown that in autistic children who are being treated for sensory integration disorder, they have progression with their individualized goals and also decrease the autistic mannerism, but further research is still needed. Alright, so these are just a couple of current trends that have worked for a couple of patients for scoliosis and cerebral palsy. So for scoliosis, research was showing that before the initiation of the PT, the child was scheduled to undergo serial casting for correction of the spinal curve and was not yet rolling or transitioning in or out of sitting. By the end of the 6-month intervention period, the spinal curve had resolved to 12 degrees without the need for serial casting, and the child was walking independently. For cerebral palsy, the research showed that in children with cerebral palsy, there is more moderate evidence that backward gait training improves balance, gross motor function, step length, and velocity.
Pediatric physical therapy in a school setting. School SIG stands for School-Based Physical Therapy Special Interest Group and is used to educate and provide awareness to the benefits of offering physical therapy in a school setting. This provides an outlet for families with children who want or need to be in a school but also require help from a licensed physical therapist. A school-based PT encourages motor development activities and participation in everyday routines inside their program. Through collaboration with the child's teacher and other school staff, a mutual goal can be achieved. We can watch the child succeed, flourish, and hopefully enjoy school along with his or her classmates. We can be a part of helping a child prepare for their future, including education, self-care, and independent living.
Clinical competence. Clinical competence involves a continuous process that seeks to implement plans and procedures aimed at developing one's skills through self-assessment and evaluation. Why it is important? It is important because it helps build the patient-client relationship, and this helps the patient to build the trust they need for the PT, and it also helps the PT to gather the right information needed to be of a better service to the patient. Beneficial certification. There are several benefits of being certified pediatric physical therapist or therapist assistant. Students get the opportunity to become board certified PTs and PTAs through the American Board of Physical Therapy Specialists. Students are expected to pass the state-administered national exam in order to become a certified PTA. Every state has different requirements regarding this rule. As of June 2015, the number of pediatric certified specialists is 1,485. And there's a little video here if you'd like to watch and see what it talks about more. Continuing education. There are several educational courses that are offered in the pediatric setting. One is the measuring outcomes of the pediatric PT, defining, assessing, measuring, and testing children with complex disabilities, pediatric feeding disorders, evidence-based strategies for infants, positioning and handling. And the first two courses were the most recent courses that were offered in September of this year, and the last two probably just cost about $229 to register for it. Aquatic therapy. Aquatic therapy is the use of water exercises by relying on the water flotation ability and the temperature of the air in the aquatic environment. The types of intervention used for the child are time and temperature matters, interventions to improve function, flotation support. Why it works. Aquatic therapy has helped children with cerebral palsy by helping them build their soft tissue muscles, and it has helped with their socialization skills for children with the autism spectrum or with cerebral palsy who engage in the group aquatic therapy. Another intervention is the Go activity motor enrichment, known as the GAME. This usually, the PT would send the child home with a game that their parents would need to complete with them just to see where their skills level is. And then the skills. Pediatric physical therapists treat their patients by using different sets of skills, techniques that include gross motor skills, strength building, and activity limitations. Benefits of using these techniques for children with cerebral palsy is the physical therapist would provide a child with walking skills to reduce the disadvantage of movement. Certain impairments that physical therapists address are spasticity, weakness, poor postural control, and lack of coordination. To help with activity limitations, the physical therapist helps the child by helping them with walkers, braces, and wheelchairs. The gross motor skills. There are two important things under this particular slide, which is the P-body treatment. This is basically used to measure the small movements and activities in newly born kids up to 5 years old. And the benefits is to help the child build strong muscles, movements. And the second one is the BOT, which is also used for measuring the small movements in kids ranging from 4 to 21 years of age. And the PT uses this to compare the skills and performances of different children. And the benefits is to test the strength of the child. And how he does this is by the specific child is given a task that they have to complete in order to be evaluated by their strength in their areas of their upper and lower limbs.
To conclude our pediatric physical therapy presentation, pediatric physical therapy is a large, changing field that continues to improve function, mobility, strength, balance, and more for children's needs. There are several diseases that can affect children, but also several techniques and trends that are in place to help children and families cope and learn how to properly care for those needs. We can't predict the future of children, but we can study and learn from the past and work towards improvements for the future. Knowing what a pediatric physical therapist is, I feel we can safely say that the goal is to have a child come in and leave stronger and in better physical health than when they walked in. With all the outlets available for us to take extra steps in becoming a specialist, like in aquatic therapy and using the TheraSuit method, we can apply these to fit the needs of children. The goal isn't to have an in and out experience, but a steady, consistent treatment plan to best achieve the most physical functionality as possible for the specific individual. To conclude pediatric diseases and injuries, here are some examples: cerebral palsy, scoliosis, spina bifida, muscular dystrophy, and ASD. These are all common. Most pediatric injuries come from motor vehicle accidents, falls, burns, drowning, suffocation, and poisoning. The age for pediatric patients are 0 to 19. The settings are typically outpatient clinics, hospitals, schools, daycares, and more.
To conclude clinical competence, this helps in skills improvement and helps build trust between the PT, PTA, and the patients. Education and certification. There are a variety of courses offered to help PTs and PTAs improve their learning abilities. And in the skills, gross and fine motor skills is mostly used for movement improvement in kids ranging from 4 years old to young adult age, which is 21.
Right, to conclude the treatments or trends, the current trends of pediatric physical therapy, there are aquatic therapy, which was designed by OTs and PTs, and it helps to increase the body awareness and is fun for kids. Then there's hippotherapy, which helps improve motor skills and improves muscle toning, and it also includes cognitive and psychological benefits. There's a TheraSuit, which helps pediatric patients that puts them through a very intense program and includes the various exercises. The kinesiotaping, which helps with inflammation, pain, neuromuscular disorders, and Down syndrome. And then the sensory integration, with the two types being hyperactive, hypoactive, and again is most commonly seen in autism.